This analysis describes pregnancy outcomes among women living with HIV who received the quadrivalent HPV vaccine during pregnancy. Human papillomavirus vaccination is particularly important among women living with HIV, as they experience higher rates of HPV infection and associated disease than women without HIV. So far, data on HPV vaccine immunogenicity and efficacy in women living with HIV has been very promising. Reaching the global goal of cervical cancer elimination in a timely manner will require vaccination of high-risk groups such as women living with HIV beyond the school-age vaccination programs and including reproductive age women, which raises the possibility of inadvertent vaccination of women during pregnancy. Large studies of inadvertent HPV vaccination during pregnancy in women without HIV have found no increased risk of adverse pregnancy outcomes. However, no such studies have been conducted in women living with HIV to date. The objective of this analysis was to assess pregnancy outcomes among women living with HIV who received HPV vaccine while pregnant or within 3 months prior to conception. This was a sub-analysis from a prospective cohort study of HPV vaccine immunogenicity in women living with HIV. 415 girls and women were recruited from 14 sites across the country and were offered 3 doses of quadrivalent vaccine at 0, 2, and 6 months. Participants were not pregnant at the time of study entry and were willing to avoid pregnancy during vaccination. We collected demographic data, ongoing health history, and additional clinical data over the initially 2-year study period. If conception did occur during the study, pregnancy and infant outcomes were documented. Ultimately, 353 women living with HIV received at least 1 dose of vaccine. The median age of these women was 36, and 67% had a suppressed HIV viral load at baseline. 8 women were vaccinated while pregnant at a median gestational age of 0.4 months, and 9 women were vaccinated within 3 months preconception at a median of 1 month preconception. Among these 17 pregnancies, there were 9 live births, 7 therapeutic abortions, 1 spontaneous abortion, and no stillbirths. Of the therapeutic abortions, 3 out of 7 occurred to women vaccinated while pregnant. The reason for therapeutic abortion was not documented. The spontaneous abortion occurred to a woman who was vaccinated while pregnant, but occurred 3 months after the vaccine dose was given and does not appear related. Among the 9 live births, the median gestational age at delivery was 39.4 weeks, so at term. Median birth weight was normal at 2,830 grams, and median APGAR scores were high at 9 on both first and second assessment. There were too few women in our cohort that experienced vaccination near or during pregnancy to robustly compare pregnancy outcomes with that of a control group who were not vaccinated during pregnancy. But in conclusion, we did find that adverse pregnancy outcomes were uncommon among vaccinated women living with HIV in our national cohort, and these findings are consistent with reproductive safety data for women without HIV as well. And I'll just end by thanking all of the study participants and clinical sites who contributed to this work. This study was supported by CIHR, CTN, and in-kind contributions from Merck. Thank you for your interest.